Okay, sorry for interruption. Now, that case, I am sharing my screen. This case, this case is of hydrocystoma. Hydrocystoma. See the capillaries there, and you will see that this is not an easy disease to treat. Okay, again a pathological case, is it not? A pathological case. Now, here the history told me that four of his siblings have suffered from carcinoma, rectal carcinoma. Okay, first rectal polyp developed. You know that rectal polyp have a genetic association. Okay, rectal carcinoma has a strong genetic association. Four of his siblings suffered from this rectal carcinoma, and then he was having no other symptoms, just this hydrocystoma. Okay, and here the susceptibility was shown to be very low. All the body was full of red moles. Red moles, I have told, that deep engraving of psychosis. So here the pathology is there. The superficial is still it's a superficial pathology and nothing to be feared about. But if you prescribe your indicated medicine in high potency, suppose 50 m or cm, it don't supposed to act because of the low susceptibility. I prescribe him Thuja in 3C potency, repeated dose. 3C. Okay, let's wait for the result. What happens? I will discuss what happened. I will discuss after 2 weeks when the patient returns. Thuja 3C was prescribed in repeated fractional doses. Okay, because of this grave background, family background, and the low susceptibility of the patient himself. Okay, now come back. So this was the Kent's first observation. We will enter into Kent's first observation. A patient walked into the clinic somewhat stoop shouldered with a hacking cough that he has had for a good many years. You judge by his look that he has been sick a good while. His face is sickly. He is lean and anxious. He is careworn. He is suffering from poverty and poor clothing and scanty food. Now you examine all his symptoms and they clearly indicate that he needs an antisoric. For symptoms are covered by an antisoric, and from history of the case, you know he has needed it a good while. Upon prolonged examination, the antisoric you have in mind is strengthened. You know, now examine his chest and discovered he has not expansion that he ought to have, and you detect the presence of tuberculosis and feeble pulse and many other corroborating symptoms. You ascertain that the patient has been steadily declining. You give the medicine and he come back in a few days with quite a sharp aggravation by the aggravation of symptoms. He has an increased cough, he has a night sweat, and he is more feeble. Now the homeopathic physician likes to hear that. He likes to hear of an exacerbation of the symptoms, but this patient comes back in a week and aggravation is still present and is somewhat on the increase. The patient is coughing worse and the expectoration is more troublesome than ever. His night sweats that have been going on, he comes back at the end of the second week and is still worse. All the symptoms have been worse since he took the medicines. All the symptoms which were there has been growing worse. He was comparatively comfortable before he took the medicine, but at the end of fourth week, he is steadily growing worse. There has no amelioration following this aggravation, and he is evidently declining. He now cannot come to office for he is so weak. This you will notice that this is the aggravation of the patient's symptoms. Okay. What is disease aggravation? What is homeopathic aggravation? We have discussed many a times before. What is medicinal aggravation? We have discussed many a times before. The symptoms coming from the arena of medicine is medicinal aggravation. The symptoms coming from the arena of disease like prostate cancer, and the patient is complaining of a new symptom which is a backache, and you know the prostate cancer is metastasis, prostate cancer's metastasis is to the vertebrae, and that will produce a severe backache. And you know from the arena of disease, this symptom is coming from arena of disease. This is the disease aggravation. Rog roger moto ache, rugi rugir moto ache. Okay, rog is progressing, disease is progressing. Okay, and rogi is the patient is declining. So this is the symptoms coming from arena of disease, and this is disease aggravation. Your medicine have not touched the plane of the symptoms. Okay, now this is and what is homeopathic aggravation? The aggravation of the original symptom, the aggravation of the original symptoms of the patient for which he has came to you. Okay, so this is the homeopathic aggravation. This then, and homeopathic aggravation, suppose the patient was standing here. The patient was standing here at the borderline, and what homeopathic aggravation will do, it will push a patient a little bit and then towards the cure. But suppose your homeopathic aggravation is so severe that it has pushed the patient and there is no scope of coming back. So this is the first observation. This is the first observation of Kent. This then will be the first observation. Underline this. A prolonged aggravation and final decline of the patient. A prolonged aggravation and final decline of the patient. What we have done? It has been a mistake. The antisoric was too deep. So this would be your reason what this has happened, why this has happened. It has established a destruction. Why it has established a destruction? Because it has pushed the patient towards the so much homeopathic aggravation was there that patient was at borderline, and it has pushed the patient towards destruction. Antisoric was too deep. Underline this. In this state, the vital reaction was impossible. This reaction was needed. That gone and come back. Gone and come back. This reaction was needed, but gone and gone. There is no scope of coming back. So this is rarely observed. You will be rarely observing these things in your clinic. Okay. So don't be afraid of using high potencies in your clinic if you are sure of your susceptibility, of your patient's susceptibility. We may have an aggravation which is an aggravation of disease in which the patient is growing worse, or we may have an aggravation of the symptoms in which the patient is growing better. An aggravation of disease means that the patient is growing weaker, the symptoms are growing stronger, but the homeopathic aggravation, which is the aggravation of the symptoms of the patient while the patient is growing better, is something that the physician observes a true homeopathic prescription. The true homeopathic aggravation, I say, is when the symptoms are worse, but the patient says, I feel better. We must now go in particular concerning these states as to, very sorry. We have missed. It was just the previous paragraph I was reading. This then will be the first observation, a prolonged aggravation and a final decline of the patient. What we have done? It has been mistake. Antisoric was deep. It has established destruction. Underline this. Mistake. Antisoric was deep. Established destruction. In this state, the vital reaction was impossible. It was an incurable case. The question immediately comes up. What are you do? What are you to do? Are you not going to give homeopathic remedy in such cases? The patient steadily declines. If you are in doubt about such action of remedies and making the patient worse, you will probably have an undertaker's certificate to sign before long. In incurable and doubtful cases, no higher than 38 or 200 potency. This is what to do. These doubtful cases, you have to start with 30 or 200 and observe whether the aggravation is going to be too deep or too prolonged. There are many signs in the chest. Such cases to make a physician doubt where he will give a deep remedy when organic disease is present. Underline this. Of course, this doesn't apply when things are only threatening. When you have fear of their coming, but when you are sure of their being present. In the instance, give the probabilities that remedy has been too late and it has attempted to erode his economy but turn to destruction his whole organism. Then begin in such cases with moderately low potency, and 38 is low enough for anybody or anything. Underline this. 38 is low enough for anybody or anything. You know the Kent's octave we have discussed in the last classes. 200 is the highest of the lowest and the lowest of the highest. So sometimes some physicians prefer to start with 200. Okay, potency 200. Who are a strict Kentian follower, they are using mostly 200 because they are they are following Kent and more giving importance to mental symptoms. We have discussed these things in detail, that what is the fallacy, what is the demerits of giving much importance to mental symptoms. Though these are important, but these will often mislead you. This often mislead you. When the patient doesn't next paragraph, when the patient doesn't seem to be quite so bad as the one I have just described, you get him a little earlier in his history before the trouble has gone quite so far, and then if you administer the same very high potency in same way, you will make a second observation. Underline this second observation. Though the aggravation is long and severe, yet you have a final reaction or amelioration. The aggravation lasts for many weeks, perhaps, and there is feeble economy seem to react, and there is slow but sure improvement. It shows that the disease has not progressed quite so far. Underline this. The changes have not become quite so marked. At the end of 3 months, underline this, is prepared for another dose of medicine. This is Kent's method of prescribing medicine, that is 4th edition prescribing. 4th edition single dose wait and watch method. Is prepared for another dose of medicine, and you see a repetition of the same thing, and you may know then that the man was on the borderland, and had he gone further, cure would have been impossible. It is always well in doubtful cases to go to the lower potencies, and in this way we go cautiously. By lower potency, Kent's mean 30. Okay. In Kent's octave, there is no rule of 12 or 6. Kent's octave start with 30th. This way cautiously prepared to antidote the medicine if it takes wrong course. Then the second observation is long aggravation but final and slow improvement. Underline this. Second observation, long aggravation but final and slow improvement. If at the end of a few weeks he is a little better and symptoms are a little better, then when he took the dose, there is some hope that finally the symptom may have an outward manifestation whereby he will attain final recovery. But for many years you may go along with prolonged aggravations. You will find in such patients that there was the beginning of some very marked tissue changes in some organ. We may know by observation the action of remedy that the state tissue are in, as well as know something about the prognosis of the patient. Here the prognosis is favorable. The third observation, this is the most desired, not the fourth observation. Fourth observation is amelioration, permanent amelioration without an aggravation. This is the most desired aggravation. The third aggravation, you will be asked in your MCQ, in your university examination, in your Bible table, which is the more desired. You will see, you will say that third observation. And why? The answer will be there is an aggravation and the patient and the physician is sure of it. Medicine, sure of his medicine. So the third aggravation observation is most desired one. Okay, the third observation. After administering the homeopathic remedy, is where the aggravation are quick, short and strong with rapid improvement of the patient. Okay, quick, short and strong with rapid improvement of the patient. Whenever you find an aggravation comes quickly, is short and has been more or less vigorous, then you will find improvement of the patient will be long, improvement will be marked. The reaction of the economy is vigorous and there is no tendency to any structural changes in vital organs. Any structural changes that may be present will be found on the surface. Okay, like this hydroma, just I have discussed hydrocystoma on the superficial. Whenever you find aggravation comes quick, any structural change that may be present will be found on the surface. In organs that are not vital, abscess will be formed and often the gland that can be done without will suppurate in regions that are of no importance to life of the patient. Such organic changes are surface changes and are not like the changes that take place in liver, in kidney, in heart, in brain. Make a difference in your mind. This sentence should be underlined. Make a difference in your mind between organic changes that take place in organs that are vital, that carry on the work of the economy, the organic changes that take place in structure of the body that are not essential in life. Okay? These two pathologies should be differentiated. An aggravation quick, short, strong is to be wished and is followed by quick improvement. Such is the slight aggravation of the symptoms that occurs in the first hour after the remedy in an acute sickness or during the first few days in a chronic sickness. Underline this. We have discussed the time of aggravation. We have discussed the time of aggravation of the symptoms. Means what time the aggravation will be shown in the chronic cases and at what time in the acute cases. Okay, so first few hours in the acute cases and first few days in chronic cases. We have said that sulfur will take at least 8 days to show its action. Okay, under the fourth observation, underline this. You will notice a class of cases wherein you will find very satisfactory cures where the administration of the remedy is followed by no aggravation whatever. Underline this. This is not that there is no aggravation. There is aggravation, but it is so feeble that it is not observed by the patient's economy or patient's vital force. Okay, it is so feeble. Under the fourth observation, you will notice a class of cases when you will find very satisfactory cure where the administration of remedy is followed by no aggravation whatsoever. There is no organic disease, no tendency to organic disease. There is the condition itself which is remedy is suitable, is not of great depth, belongs to functions of the nerve rather than to the threatened changes in the tissue. You must realize, okay, to understand this, what Kane have meant by the tissue changes and the changes on the nerve and function, you must go to the chapter 6, the first chapter of Kane's lecture. The chapter 6. Okay, there he discussed, there is a book by we have discussed this journey of disease in our initial classes many a times. There is a book, there is a physician in Switzerland called Jus or Jess. This book, The Journey of Disease. This book will clear your idea, a concept, homeopathic concept of cure and suppression. This Mahinder Singh Jus, okay, he was the student of B.K. Bose, the great B.K. Bose of Calcutta Homeopathic Medical College and Hospital, under whom George Vitholkas also have studied. There was some differences with B.K. Bose and George Vitholkas, so he was not able to continue his studies under B.K. Bose. So this Mahinder Singh Jus is now presently practicing, I think, in Switzerland, and this is one of the books he has written, The Journey of Disease. This book will clear a bit of your conception of different stages of disease, the tissue stages, the nerve functional stages. Okay, disease starts at functional level, go to tissue level, then suppress and fall back on the center and affect the will. All these we have discussed in our initial classes. That, and along with this book, first read the chapter 6 of Kent. Read the chapter 6 of Kent to understand this journey of disease. What is the journey of disease? Journey of disease means disease starts and going round and round and round. Okay, over whole body, producing some symptoms like in body. Suppose this is disease going in body, going in economy, and producing some symptoms. Okay, finally it settles down somewhere. It settles down somewhere, and this we called pathology. This was dynamic pathology. Okay, up to this was dynamic pathology, producing symptoms. Now disease journey, and disease have to settle down somewhere. Suppose it has settled down in gallbladder as your stone. Okay, now this and still the disease is producing some symptoms there, but have settled down as a pathology somewhere. Now what this stone will do? This stone will produce of its own some symptoms. Its own symptoms. We called it the secondary symptoms due to this pathology. Okay, it will produce the pain in right hypochondriac gallbladder colic. Okay, it will produce the gallbladder colic, the Murphy's signs, all will be there. The vomiting, the pain, the fever may be there because this stone is producing all these symptoms, and these are the secondary symptoms of this. These are secondary symptoms of this pathology. Okay, now if you are covering these symptoms, you are not covering the disease. Okay, you are not covering the disease, rather you are covering only the secondary symptoms. We have discussed this during discussion to surgical disease and during discussion to journey of disease. In our initial classes, later on when we have discussed aphorism number 186, we have discussed this. So what to do? We do in these cases. You are covering the symptoms, well and good, you should cover the pathology also. Rather, if you are able to cover these functional symptoms of the disease, then only you are covering the disease in mass. As a whole, you are covering the disease. Okay, clear? Like that ascites is causing, listen very carefully, ascites is causing breathing distress. Okay, now this ascites is due to portal vein obstruction, and that portal vein obstruction is due to cirrhosis of liver. Okay, and that cirrhosis of liver is due to the disease which have traveled this way. Okay, now if you are covering the ascites without any coverage to the portal vein obstruction, and you are covering the ascites and portal vein obstruction without covering the cirrhosis of liver, and you are covering, again you are covering the breathing distress, ascites, portal vein obstruction and cirrhosis of liver without covering the disease which have caused it, still you are bound to fail. Okay, so that way the concept go. So for the breathing distress, if you think you took the symptoms and you will prescribe the breathing distress won't go, because it is due to the pathology of ascites. Now you are prescribing for ascites, the ascites won't go, because this is due to the pathology of portal vein obstruction. You are prescribing for portal vein obstruction, the portal vein obstruction will not go, because it was due to the cirrhosis of liver. And now you are prescribing to the cirrhosis of liver, the cirrhosis of liver will not go because this is due to the disease which is running behind. So you have to, that is what we have discussed in last class, the covering of the pathology and the covering of the miasm. Okay, you have to see your patient as a whole, and you should, this concept of disease should be clear in your mind. Okay. Now, this by the tissue changes and by the functional changes, what Kent have meant. So we have to go through this journey of a disease by Mahinder Singh Joss and the 6th chapter of Kent. And the 4th observation, you will notice a class of cases where you will find very satisfactory cures where the administration of the remedy is followed by no aggravation whatever. There is no organ disease, no tendency to organ disease. The chronic condition itself to which the remedy is suitable is not of a great depth, belong to the functions of nerves rather than threaten changes in tissue. Tissue changes will occur after years of travelling of disease through whole body. You must realize that there are changes in tissue so marked that the vital force is disturbed and following through the academy and gets so slight that man with all his instrument of the precision cannot observe them. Under such circumstances, we may have sharp suffering, but cures may come out without any aggravation. We know then that if there is no aggravation, the potency sharp suffering, underline this sharp suffering will indicate the high susceptibility. Open aconite of Allen, and you will see aconite from Allen, and you will see the sudden of whom, the sudden complaint of whom, recent cases occurring young person, especially girls of a full plethoric habit who led a sedentary life, persons easily affected by atmospheric changes, dark hair, eyes and rigid muscular fiber. Okay, plethoric habit, full vigorous persons, and sudden complaint and the sharp suffering. This, if in acute case, if the, you will see that there are some fevers which classified under fever of unknown origin. Okay, these are the cases of low susceptibility. Fever of unknown origin. There are fever, there is hyperpyrexia of pyrexia of not hyperpyrexia, pyrexia of unknown origin. There are fever, but the cause is the cause cannot be discerned. And there are cases where there is a pus collected somewhere in the body and no fever is there. Okay, these are the cases of low susceptibility, unable to produce the symptom. And the cases of high susceptibility, you will see that the patient is complaining of high fever, sharp pain, okay, throbbing, sharp, redness, belladonna, like aconite, okay, and full symptoms will be given. But if you are still sharp sufferings are not there, but somehow you are recognizing that this may be a case of aconite, give it low. Okay, don't go for higher 1m or 10m, but go for low if the sufferings are not sharp. Okay, we know that then that if there is no aggravation of the potency just exactly fitted the case, but you have a course of things that you need not to always expect. Though there is nothing but changes in economy after potency that is not suitable, either too crude or too high, for that patient you will have an aggravated state of symptom. In cure without any aggravation, we know that the potency is suitable and remedy. Too crude or too high potency, underline this. Next, any aggravation, we know that the potency is suitable and the remedy is curative remedy. provided that the symptoms go off and the patient returns to health in orderly way. Orderly way, underline this. What is this orderly way? From within downward, from above downward, from less important organ, from more important organ to less important organ. Okay, this is the travel of disease and the cure is universal. It is highest order of cure in acute affection. Yet the physician sometimes will be more satisfied if in the beginning of his prescribing he notices slight aggravation. That is why the third aggravation is most wished for. The fourth observation then relates to cases in which we have no aggravation with recovery of the patient. Underline this. No aggravation with recovery of the patient. The fifth observation. The amelioration comes first and aggravation comes afterward. This often you will observe in your clinic that ডাক্তারবাবু আগে তো ভালো ছিলাম এখন আবার বেড়েছে। Now this বেড়েছে, this increased symptoms should be looked for. That patient you are treating for migraine and patient told you that doctor I was better but again pain is there. But this pain is there need not to be aggravation. Maybe pain is there, the return of the symptom again when you have to prescribe the same medicine, the second prescription, same medicine again in same potency. If the intensity of the pain is low, in anything, any such complaint, you have to notice two things, frequency and intensity. Ask your patient how often this was there before, how often the complaint was there before, and what intensity was there. There are pain scales which have devised to visual analog scale VAS, visual analog scale, which is devised to numeric and give the numerical value to pain 1 to 10. The patient we used to ask to our patient 16 আনার মধ্যে বুড়ো পেশেন্ট যদি থাকে, if the old patient they know the anas, তো 16 আনার মধ্যে কত আনা ভালো, আগে থেকে কত কম। ডাক্তারবাবু একদম ঠিক হয়ে গেছিল আবার এসছে, তুই কি আগে 16 আনার মতো চলে এসছে? না ডাক্তারবাবু 4 আনা কম, আগে থেকে 4 আনা কম। If the patient is of not of old age, they won't understand this 16 आना, they will then so 100 रुपये में कितना रुपया अच्छा है, okay, so they will say that 25 पैसा अच्छा है, 100 पैसा में 25 पैसा अच्छा है, 75 पैसा अभी भी बुरा है, और 60% is better and 40% is there, like that. So like that you have to give a numerical value to your symptom, the intensity, okay, and the frequency, how often it would how often previously it was there. If the frequency has decreased, that means the medicine has worked and repeated again and should be repeated again. That is not fifth observation. Fifth observation is aggravation after, okay, we count it as fifth observation in our clinic mistakenly. If the aggravation is there only, this is the fifth observation, okay. At times you will see sickly patient, fully sick, as the one I mentioned in the first and second instance, walk into your office. After long study, you administer a remedy. The patient come back in few days telling you how much better he was immediately after taking the medicine, and now he has 3 or 4 days of what appears to be a decided improvement, a prompt action of the remedy. The patient says he is better and the symptoms seem to be better. But wait at the end of a week or 4 or 5 days, all the symptoms are worse than when he was first come to you. This should be marked. Worse than that of first he came to you. Underline this. The patient says it is not very uncommon thing in severe cases, in a case of good many symptoms, to have an amelioration of the remedy come at once, but whatever you may say, the condition is unfavorable. Either the remedy was only superficial and could only act as palliative, okay, that is the case where you are not covering the pathology and covering the symptoms, where you are not covering the disease, where you are not covering the miasm and covering the medicine, covering the symptoms. So that will be the case, superficial and act as palliative. That bleeding symptom is due to ascites and you are without any coverage to ascites, you are giving your aspidosperma, that bleeding symptoms will not go. Okay? Or the patient was incurable and the remedy was somewhat suitable. Underline this. Two conditions may be there: superficial, or the patient was incurable and the remedy was not suitable. One of these two conclusion must be okay.
Wait for me. Wait for me.